Right. So, good day to all of you. And today we are going to discuss about the health and social care context and principles. That is the unit. And we are going to discuss about the learning outcome number 4, which is understand the values, behaviors, and ethical responsibilities underpinning adult social care. Just to let everyone know that I have started the recording, and so today we will explore the core principles that guide our practice in adult social care, and we will start with understanding the fundamental values. So, like, what are the fundamental values in health and social care context and principles? So, these are dignity, respect, and independence as paramount. These values are essential because they affirm that every individual deserves to be treated with dignity, should be respected for their choices and identity. Every individual has their own identity, so we always need to consider that, and uh, should be respected for their choices, identity, and has the right to make decisions about their life. And what we do is by upholding these values, we support the self worth and autonomy of those in our care. So, uh, we will discuss the behaviors that are expected of care workers and why we think that behaviors like empathy, patience, and professionalism are important because empathy allow us to connect on a human level. Understanding the emotions and experiences of those we care for. And patience is crucial because it builds a supportive environment where the individual feels valued and not rushed. Professionalism ensures that we maintain a standard of care that is ethical and respectful. Oh, okay. So now we'll look into the ethical responsibilities. And anyone have any idea that what do they think that are ethical obligations of a care worker? Any idea from any student? And let me remind as well that if you have any questions regarding uh, anything related with the unit or the learning outcome, you can ask any question as well. Any idea regarding the ethical obligations of care worker?
I think it's to take care of day-to-day activities of the clients.
Right, correct. And what we also do is acting in the best interest of the service user. For example, we maintain confidentiality and reporting any concerns of abuse or neglect. And these are the fundamental ethical responsibilities. And these responsibilities ensure that we are not only care providers, but also advocates and protectors of our service users' right. And like to make this more concrete, we can you give an example of an ethical dilemma you might have faced in this field?
Sorry, I don't understand you.
Is there any like ethical dilemma have you ever faced working in the field?
I think there's a language barrier.
Right.
Yeah, language barrier. Then when the family of the client is overprotective.
Mhm.
Yeah.
Okay. Correct. So That's a good example. And like dealing with ethical dilemmas like respecting a client's privacy while being concerned for their safety can be challenging. And in such cases, it's crucial to balance respect for the client's autonomy with our duty to protect them. And consulting with the supervisor and adhering to legal and organizational guidelines can help us navigate these complex situations. And as a care worker, we should always remember that our actions and decisions have a significant impact on the lives of those we serve. By understanding and implementing these values, behavior, and ethical responsibilities, we ensure that our care is compassionate, appropriate, and respectful. So, this is about the initial bit of this unit and the learning outcome 4. Now in the next slide, we have indicative content, and so we have some bullet points here. Okay, so now we are going to explore some key areas of values, behavior, and ethical responsibilities in adult social care. So let's start with respect and dignity for service user. So respecting and maintaining the dignity of service user is foundational because it affirms their value as individual and support their right to make personal choices. This also ensures compliance with legal standards that protect service users' right. And next we have uh, working together to provide care. Okay, so working together means like collaboration is vital in our field, and like collaborative care ensures that various perspective and expertise contribute to comprehensive care planning and delivery, which enhances the quality of care and meets service user needs more effectively. And moving on to commitment to quality, and it's a commitment to quality involves continuously striving to improve care standards. This not only helps in meeting regulatory compliance, but also in ensuring that service users receive the best possible care. So the next we have is compassion. Okay. So why compassion? Compassion is a critical behavior in social care because compassion involves empathy and caring actions towards service user. It supports emotional well-being and helps in building trust, crucial for effective care. And continuous improvement we have next, and continuous improvement is another key area, and continuous improvement in care practices ensures that services adapt to new challenges and innovation, ultimately benefiting service user for providing up-to-date and effective care solutions. Then we have equal fair treatment. Okay, so in equal and fair treatment, uh, we can say that treating everyone equally and fairly is essential to uphold the ethical standards of justice and equity in care or social work. So, ensuring that no service user is discriminated against or disadvantaged. And then we have non-judgmental treatment. Okay, so um, non-judgmental treatment is being non-judgmental allows service user to feel safe and respected, fostering a therapeutic environment conducive to their care and recovery. Then we have competence. Okay, so uh, competence ensures that the care workers have the necessary skills and knowledge to provide effective care, which is crucial for both compliance and meeting the needs of service user. And in the last, we have person-centered care. So I always like emphasize on person-centered care because as a health and social care worker, we are always bound to to the person-centered approach or care. So, person-centered care means that the care plans and activities are tailored to the individual needs and preferences of the service user. This respects their autonomy and enhances their quality of life and aligning care with their personal values and needs. So, in that, we can see that each of these areas plays a significant role in not only providing high quality care, but also meeting in legal and ethical standards. And they ensure that we, as care provider, are aligned with the best practices and regulatory frameworks, all while deeply respecting and enhancing the lives of those we serve. This is about this slide. Okay, then we have a few other bullet points. So we have first choice. Okay, so providing choices empowers service user, allowing them to feel in control of their lives and care, which is vital for their autonomy and dignity. Then we have supporting privacy. So what does this involve and why supporting privacy is very crucial? So, respecting privacy helps maintain dignity and trust, which are fundamental for a respectful care relationship. Then, moving on to prompting independence, and prompting independence encourages service users to do as much for themselves as possible, enhancing their self-worth and quality of life. Now, consider empowerment of service user. So, uh, empowerment means enabling service users to make decisions and have control over their life beyond just physical and or emotional support. It is it's about boosting their confidence to manage their own lives. And then we have holistic care is another critical concept, and holistic care considers all aspects of person's need, including physical, mental, emotional, social, or spiritual, and ensuring that comprehensive care is there. So now we have supporting identity. Okay, so supporting identity and self-esteem, what it does, it helps individuals feel valued and understood, which is crucial for their overall well-being. Promoting service user rights is a fundamental principle, and in that, what we do is service user rights include privacy, safety, and the right to be informed about and decide upon their care. Upholding these rights is essential for ethical care. So now we have empathy. So empathy involves understanding and sharing the feeling of others, which helps in providing compassionate and appropriate care. Then we have safe practice. So safe practice means ensuring that the environment and care procedures do not pose any harm to service user or staff, adhering to all health and safety guidelines. Then we have uh, equality, inclusion, and non-discriminatory practice. Okay, so these principles ensure that no one is excluded or treated unfairly because of their background, belief, or conditions, promoting a fair and respectful care environment. So again, each of these areas contribute significantly to the quality and effectiveness of social care and fostering environments where service users are treated with respect and dignity, and their individualized needs and rights are prioritized. The next slide, right? Okay, the key terminology. So this slide is missing the information. And what we have next, okay, we have in the you have to watch a video, but there is no link to it. So we will move to the next slide. Right. In this slide, we have to analyze values and behavior underpinning adult social care. And again, we have uh, to discuss about respect and dignity, empathy and compassion. Okay, so first one is respect and dignity. So in that we can say that respecting the dignity of every individual, it means recognizing their value as a person irrespective of their condition or circumstances. And what it involves interacting with service user with courtesy and acknowledging their cultural, religious and personal preferences. And this respect forms a basis of a trusting and effective care relationship. Then we have to move on to empathy and compassion. So, empathy, what it does, it allows care professional to understand and share the feelings of service user, uh, while compassion motivates them to take action to alleviate discomfort or distress. These behaviors are crucial because they ensure that care is not only about meeting physical needs but also about nurturing the emotional and psychological well-being of individuals. Both empathy and compassion are not just about feeling, but about demonstrating through action that we understand and are committed to addressing the holistic needs of service user. So this commitment can manifest in small acts like listening attentively, providing comforting words, or adjusting care practices to better suit the emotional state and needs of service user. And like for example, if we have a, scenario like where a care worker shows both respect and empathy and describe how these values and behavior could influence the outcome for service user. So, like we can say that in some scenarios, like we give the values to we give we have a strong impact that values our uh, that has like impact on our values and behavior. And by doing so, like we by embedding respect, dignity, empathy and compassion in our daily interaction, we not only adhere to the ethical standards but also we significantly enhance the lives of those we serve. So we always need to remember that analyzing these values and behavior involves constant reflection and application. As a professional in adult or social care setting, it's crucial that we regularly assess our actions and interactions to ensure they align with these core principles. Right. So now we will move to the next slide. So in the next slide, we have person-centered care and commitment to quality. Okay. So, person-centered care recognizes that each service user is an individual with unique needs, preferences, and goals. By adopting these approach, we respect their autonomy and choices and actively involve them in decisions about their care. This not only enhances their sense of control and satisfaction, but also often leads to better health outcomes. A holistic approach in person-centered care means considering all aspects of a person's life, again, including physical, emotional, social, and sometimes spiritual needs, and ensuring that the care plans are comprehensive and tailored to the individual. Then, commitment to quality. A commitment to quality ensures that care is not only safe but also effective and responsive. This involves adhering to professional standards and evidence-based practices, as well as meeting or exceeding regulatory requirements. It's about striving continuously to improve the care we provide, ensuring it aligns with the best available practices and innovation in health and social care. Quality in care also involves monitoring and evaluating our services regularly to identify areas for improvement and implementing changes that enhances service user outcome and satisfaction. Then we have equality and diversity and ethical practice. Okay. So again, now we have to focus on two critical aspects of health and social care. This is and these are equality and diversity and ethical practices. So we'll start with equality and diversity. And in equality and diversity, what we do is embracing diversity means recognizing and valuing the differences in culture, ethnicity, and gender, age, and beliefs among service users, and is crucial to challenge discrimination and create inclusive environments where all individuals feel respected and valued. This not only enhances the quality of care but also ensures that everyone has equal access to services and opportunities to participate fully in a society. And by fostering these environments, we support a society that appreciates diversity and promotes social values. So next we have to discuss on the ethical practices. So why it is important in for care profession to maintain ethical standards, because ethical practices is the backbone of professional integrity in social care, health and social care. It involves being honest, transparent, and trustworthy in all interactions, and by following ethical codes of conduct ensures that we maintain confidentiality, prioritize the well-being of service user, and act impartially and avoiding any conflicts of interest. And what ethical practices do is it protect the rights and safety of service user and build trust with them and their families. It also safeguards the credibility and reputation of the care profession. Then in the next slide, we have to discuss about holistic approach and promotion of independence. Okay, so adopting a holistic approach means recognizing that an individual's well-being is influenced by not only physical but also psychological, social, and spiritual factors. By addressing these interconnected aspects, care professionals can provide more comprehensive support that truly caters to the diverse need of service user. And when we collaborate with the interdisciplinary team, multidisciplinary teams such as doctors, therapists, or social worker, so as well as tapping into community resources, what it does, it allows us to create a support network that addresses all the uh, factors of a person's health and well-being. So now we need to discuss about promotion of independence. Okay, so independence is fundamental to dignity and self-esteem. Empowering service users to make their own choices and develop skills enhances their compatibility to manage their own lives. This not only fosters a sense of accomplishment and self-worth, but also aligns with person-centered care, where the preferences and the abilities of the individual are respected and prioritized. So, promoting independence does not mean that leaving service user to manage on their own. It's about providing the right level of support and assistance when needed, enabling them to perform tasks themselves to the greatest extent possible. And this is all about it. Then we'll move to the next slide. Now we have continuous improvement. Okay. So continuous improvement means constantly reflecting on our practices, seeking feedback from peers, service users, and supervisors, and being open to learning and adapting. This proactive approach ensures that our services remain effective, relevant, and responsive to the changing needs of those we care for. Continuous improvement is not just about correcting mistake, it's about striving for excellence in every aspect of care. This involves engaging in ongoing learning and professional development opportunities. Then what we have- okay. Now we have the conclusion. So in the conclusion, uh, what we have is by analyzing the values and behavior underpinning adult social care, stakeholders can gain insight into the principles that guide ethical practice, inform professional standards, and promote positive outcomes for service users within the sector. Right. So we have discussed about all those things, and we need to identify the issue is the first step. For example, when taking care of a service user, and then what we do is followed by gathering data to understand the scope of the problem, or any concern the service user has, and then we will find out some solution, maybe like with the help of the team. So we will have the multidisciplinary team working together, and in the end what we do is we effectively reduce response time, and finally we solves the problem of the service user. And now we will move to the next slide. Okay, in the next slide we have to analyze ethical responsibilities in adult social care. So we have to talk about duty of care. Okay, so the duty of care essentially means that care professionals have a legal and moral obligation to ensure that the safety and well-being of service users. This duty compels us to act in the best interest of those we care for and take responsible or reasonable steps to prevent harm. So we can break down what it involves. So first, it requires us to be trained and competent in our roles, and being competent means having the necessary skills, knowledge, and expertise to perform our duties effectively. And without this, we risk causing harm through ignorance or mistake. Secondly, our duty of care involves mitigating risk. This can mean anything from making physical environment safe to ensuring that psychological needs are met. And these are the important points. And providing appropriate level of support and assistance is crucial. This means tailoring our care to meet the specific needs of each service user, which ties back to person-centered care. Okay, then we'll move to the next slide. Then we have autonomy and informed consent and confidentiality and privacy. Okay, so we have to discuss two more ethical responsibilities. And for example, in autonomy uh, is about respecting the individual's right to make their own decisions. Um, and this is fundamental in social and healthcare. What it does, it affirms the dignity and self-determination of service users, supporting them to make informed decisions, involves ensuring they have all necessary information about their care options, potential risks, and benefits. What it does, this empowers them to make choices that align with their values and preferences. So uh, now we have confidentiality and privacy. So, confidentiality and privacy are about protecting personal information and respecting the personal space and dignity of service user. This builds trust between service user and care professional and is crucial for ensuring that individuals feel safe and respected in their care environment. And if we address if there's any breach or for example, we don't have we always consider the confidentiality, and if there's an issue, what we do is we escalate these issues to the management if needed, and sometime we need to review the policies with the team to prevent future harm to the any service user. And now what we have next, okay, non-discrimination and equality. and respect and dignity. Okay, so promoting non-discrimination and equality ensures that all service users are treated fairly and equitably. Um, and what it does, it ensures that all service users are treated fairly and equitably, and regardless of their age, gender, ethnicity, and disability, religion, sexual orientation. It's about creating an environment where everyone feels respected and valued. Challenging discrimination and prejudice is not just about avoiding negative behaviors, but actively promoting a positive, inclusive culture in the health and social care industry. So now we have respect and dignity. So treating service user with respect and dignity means recognizing their in worth and ensuring that they recognize what are their values and everything, and it's about seeing beyond a person's condition or circumstances and focusing on valuing their humanity. So what it does, it fosters a culture of mutual respect, empathy, and understanding, which are crucial for effective care delivery. It also greatly enhances the service user quality of life, as feeling respected can positively impact their mental and emotional well being. Then we have honesty and integrity and professional boundaries. Okay, so um, honesty and integrity are fundamental to building and maintaining trust with service users, colleagues, and other stakeholders. By being transparent and truthful in all interactions, care professionals uphold the trust placed in them by those they serve and the community. This includes being accountable for one's action and decisions, which is crucial in fostering a reliable care environment. And for example, um, situations like reporting mistake, handling confidential information, or communicating about care plans require honesty and integrity. And now we will discuss about professional boundaries. So maintaining professional boundaries means ensuring that relationship with the service user uh, remain professional and do not become personal or exploitative. What it does, this protects both the service user and the care professional, preserving the integrity of the care relationship and ensures that decisions are made based on the best interest of the service user, not personal emotions or relationship. The care worker should if there's something someone is trying to give gifts or any trying to get some personal favor. So what we do is the care worker should politely refuse the gifts and explain the policies regarding gifts and boundaries. And what it does, that it may also be appropriate to discuss this situation with supervisor sometime to ensure transparency and seek advice on managing these service user emotions and expectations. Then we have quality of care and advocacy and empowerment. Right. So, uh, providing high quality care is fundamental to ensuring that the needs of service users are met and their well-being is promoted. This involves adhering to professional standards, best practices, and regulatory requirements. It's about being committed to continually improving the care we provide, staying updated with the latest research, and applying evidence-based practice in our work. So, uh, regular assessment, feedback from service user and their families, and compliance with healthcare standards are all crucial for maintaining high quality of care. Implementing quality improvement initiative based on the feedback is also important. Now we have advocacy and empowerment. So, what does it mean to advocate for and empower service user? Advocating for and empowering service user means supporting them to make their own decisions and ensuring their rights, interests, and preferences are considered in care planning processes. It involves speaking up for the individual who may be vulnerable or marginalized, making sure their voices are heard and respected. Empowerment is particularly important as it encourages service users to participate actively in their own care, which can lead to better outcome and greater satisfaction with the care they receive. So, by advocating for service user and empowering them to take part in their care decision, we not only respect their right but also enhance the quality of care. And as like the service user preferences and needs are more likely to be effective, we should always listen to their concerns and uh, take care of them according to their wishes and needs. Okay, so now we have the conclusion. And in the conclusion, by analyzing these ethical responsibilities in adult social care, stakeholders can gain insight into the moral principles and principal values that guide the ethical practices, inform professional conduct, and promote positive outcome for service user within the sector. So we have discussed all of these, like what could be the benefits of like the analyzer can inform training program, policy development. So these all are important for fostering a culture of ethical excellence and integrity in adult social care provision. So now we'll move to the next slide. Okay. In the next slide, uh, we have to evaluate the importance and impact of values and behaviors underpinning work in adult social care. We have to discuss about promotion of dignity and respect, and what are the importance of it and what are the impact of it. Okay, so we need to evaluate the importance and impact of values and behaviors in adult social care. So uh, the promotion of dignity and respect is indeed fundamental because it directly influences how service users feel about themselves and their care. By valuing and respecting each individual, care professionals create a positive environment that supports the autonomy and independence of service user. This is crucial for their self-esteem and overall well-being. Now we'll explore the impact of these values. Uh, when service users feel respected and their dignity is upheld, they are more likely to trust their caregivers and engage more openly in their care. This trust and open communication facilitate with better care planning and delivery because service users feel comfortable sharing their true preferences and needs. Respecting cultural backgrounds and individuality can significantly enhance cooperation and satisfaction with care services. What it does, it helps in tailoring care practices to meet the specific cultural and personal needs of service users, which is essential for effective person-centered care. So then we have, okay. So when we promote these values and not only benefits the service user, mm, what it does, like it enhances the work environment, making it more humane and compassionate. It can improve staff morale and retention, as employees feel proud to be part of an organization that truly values and respects its service user. And it also boosts the reputation of the facility, attracting more service user and potentially leading to better compliance with standards and regulation. So these all are the impact of dignity and respect as a service provider. Okay. Then in the next slide, we have empathy and compassion, then just impact and importance, then person-centered care, importance and impact. Okay. Uh, Empathy and compassion are important because they help care professionals connect with service user on a deeper emotional level. By understanding and sharing the feelings of others, care professionals can provide not just physical care but also emotional support and comfort. This holistic approach is essential for comprehensive care. Uh, the impact of these qualities are, for example, empathy and compassion can significantly alleviate distress, anxiety, and loneliness among service users. These qualities promote emotional well-being and resilience, helping individuals feel understood and cared for, which is crucial in fostering a sense of belonging and security within the care setting. Uh, this is the impact, and now we have to move on to person-centered care. And person-centered care again is important because it ensures that care services are tailored to the individual needs, their preferences, goals of service user, and this approach respects their autonomy and acknowledges their right to be involved in decisions about their own care. So, what might be the impact of adopting a person-centered approach on the outcomes for service user? So, person-centered care typically leads to more relevant and effective care intervention by focusing on what is important to service user. This approach enhances their satisfaction and quality of life. It also promotes greater engagement and collaboration in their own care, which can lead to improved health outcomes. So, what it does, integrating these principles might involve sometime adjusting the care plan to include supervised walks or outdoor activities, which reflects understanding and compassion towards the service user preferences. Then next is commitment to quality, its importance and impact. Okay, so the concept of commitment to quality uh, in adult social care or health and social care is the commitment to quality ensures that the care provided is safe, effective, and responsive. This means adhering to the highest professional standards, meeting regulatory requirements, and following best practices. Is essential for ensuring the service user receives the best possible care. Now we have to discuss about the impact of this commitment. So, what would be the impact is uh, investing in quality improvement initiatives and continuous professional development significantly enhances the importance and the competence of the service user of care professional as well. This in turn leads to better care outcomes and reduces the risk of harm or errors. When care professionals are engaged in continuous learning and improvement, it also increases the trust and confidence that service user and their family place in the care services. This is crucial for building a strong relationship and ensuring the sustainability of care institution. And This is all about it. Um, can we move to the next slide? In the next slide, we have promotion of equality and diversity, and again, its importance and impact and ethical practices, and importance and impact. Okay, so when we discuss about promoting equality and diversity and inclusion, what it does, it ensures that care services are accessible to everyone, regardless of their background. It also ensures that services are culturally competent and responsive to the diverse needs and preferences of service users. This is crucial for providing effective and personalized care. Then, uh, the impact of these principles. So, when we follow diversity and actively combating the discrimination, what it does, it fosters a culture of respect, acceptance, and belonging. This not only improves the experiences and engagement of service users, but also leads to better outcomes by reducing disparities in access to care and health results. It makes the care setting a more inclusive and supportive environment for everyone. Now, we'll move to the ethical practice. Okay. So, why ethical practice is crucial for care professionals to uphold ethical practices? Because like ethical practices is foundational to maintaining integrity, honesty, and accountability in all interaction within the care sector. It governs our decisions and behavior, ensuring that we act in the best interest of those we serve. And what might be the impact of adhering to ethical standards and codes of conduct in the care sector are like adhering to ethical standards promotes trust and confidence among service users, colleagues, and other stakeholders. It also enhances the professionalism of care services, safeguarding the rights, interest, and well-being of service users. It also boosts the reputation and credibility of the care sector in the eyes of the public and regulatory authorities, ensuring compliance and fostering public trust. So this could be the impact of it. And then in the next slide, we have a holistic approach, its importance and impact. Then promotion of independence, its importance and impact. Okay, so we have discussed holistic approach already, but in this slide, we'll say that a holistic approach is crucial because it recognizes the importance of all aspects of a person well-being, which involve physical, psychological, social, and sometimes spiritual uh, as well, needs as well. So, uh, what it involves a comprehensive and integrated approach ensures that care meets all the diverse and complex needs of service users, not just their medical or physical needs. So, what would be the impact of the holistic approach? So, by addressing all dimensions of well being, a holistic approach can lead to better health outcomes and improve quality of life. It also promotes greater satisfaction and engagement among service users, empowering them to take an active role in managing their health and social care needs. Then we have promotion of independence. Okay, so when we talk about promotion of independence, so promoting independence and is vital as it empowers individuals to they can exercise their choices and control over their daily life. This support boosts service their confidence and dignity and self-esteem, which is foundational for a person's overall well-being. And the possible uh, impacts could be uh, like when we encourage independence, so it not only fosters resilience and self-efficacy, but also promotes social inclusion, allowing individuals to lead fulfilling lives within their communities. And what it does, the impact is this reduces their dependency on formal care services, which can lead to more sustainable care models and a reduced burden on healthcare system. So these could be the impacts. So, and we can say that the importance of integrating empathy, compassion, respect, dignity, and ethical practices cannot be overstated. These values foster trust and confidence between service user and care professional, enhancing the therapeutic relationship that is central to effective care. By committing to these principles, care professionals not only improve the quality of life for those they serve, but also contribute to a more just and humane society. So, the discussion on continuous improvement. Okay, so what we have next in conclusion. Okay, yeah, so we discussed about the values and behaviors underpinning work in adult social care, and from the point of view of stakeholder diverse the key drivers of quality care, identifying areas for improvement and inform strategies. Right. Okay. So we have discussed these, and what we have next is okay. So now we have the references. So we need to conclude our lecture. So as I discussed earlier, like um that the importance of integrating empathy and compassion, uh, dignity, or like practical ethical practices, it is like very important. Uh, and the discussion on continuous improvement and professional development is very vital. And for example, in our future role as social care professional, or we are working in the field, so what we can do is we need to remember that our actions and decisions have a profound impact on the lives of individuals who are often at their most vulnerable state, and strive to um, embody the values we have discussed today in every interaction and decision. By doing so, what we do is we ensure that our practices not only meets the standard of profession, but also honors the dignity and worth of every individual you serve or we serve. So, for example, if we say that uh, if we carry forward these discussion and insight into our daily practices and continue to reflect on how we can better serve and support our communities through compassionate, ethical, and high quality social care. So it is again important for us to always look for the values and ethical practices and also to improve ourselves. So if there's any question, then the you can ask. I'll try my best to answer those as well. And again, like you all the students should like look for the assignment briefs properly and look for the command verbs and command words. Also look for the keywords which are required to answer in the assignment brief. and what is the assessment criteria asking us to do. We always need to look for the important points and then like write our answer according to the uh, assignment brief or the assessment requirement. We also like need to do the proofreading. Proofreading is also important when we finalize our answer, and also we need to look for the plagiarism. We have to make sure that we don't do a plagiarized work, and also we need to give credit to the original author of the content. So how we do that is when we give them like in-text citation and we provide the references in the end, we follow the Harvard referencing style, and by that uh, we make sure that we give proper credit to the author. So as we were talking about, for example, in the healthcare industry, that we always need to follow the ethical principles or ethical guidelines. Same applies to uh, education as well. In the academic context also, whenever we are writing anything, we always have to give the credit to the original author, because we are not the original authors what we are writing. So ethically it's correct that we always give the credit to the author. Then we can rewrite it in our own words, and we can present our uh, presentation or assignment for submission, and then we will be marked against it. And look, as we do the ethical, as we follow the ethical practices in academic writing as well. So it's important when we are dealing with service user, we are dealing them physically. So we have to again look for the ethical principles and uh, values and policies of the organization we work with. So we always need to follow the policy guidelines, and whether it's organizational values or professional values, or like professional policies, or organizational policies, or national policies, we always need to adhere to the professional policies and laws and regulation which are related with the uh, organization or the sector we are working in. And we all also have discussed about the impact and like the importance and impact of these values as well, or what impact it does. It always like have a positive impact. If we follow all the guidelines or the principles or professional values and standards, what it does, it impact as a it has a positive impact in the professional way, and our service user would be happy and they will give us a high rating, or will have more service users, the business will flourish, and like the service user would be happy. So it's not only the service user, also the service providers. As we are service provider, we are taking care of someone, so we could be happy as well. And if we are happy, and if we are physically, mentally, emotionally, or spiritually, we are like satisfied, then what would be the impact? Again, it would impact on us in a positive manner, and also on the business as well. So we always look for the positive sides, and we always try to learn from our mistakes, or we try to do the trainings or the CPTs we follow. Then by doing the CPT training and everything, it makes us better in our work environment. So any question regarding today's lesson? Mm, I think there's no question. So then I will finish today's lecture then. And I am thankful to all of you for attending the lecture. And if you have any concern, any question, you can ask me. You can ask the management as well. We all will try to help and support you. So We'll meet then next week. So take care of yourself. Bye.